Hey guys, this is Dr. Up. Today we'll look at the diuretics and we are seeing the site and the mechanism of action. So first we look at the CAI, the carbonic anhydrase inhibitors. So the site of action is going to be the proximal tubule and the enzyme receptor transporter inhibitor is the carbonic anhydrase. Then we look at the loop diuretics. So in loop diuretics, the site of action will be the thick ascending loop of Henle. So it's a thick ascending loop of Henle. And what will be the transport inhibited? So inhibited is the sodium, potassium, chloride, symporter. So this is what is inhibited. Then we look at the thiazide. So under thiazide, the site of action will be the DCT. DCT stands for the distal convoluted tubule. And what will be the transporter inhibited? It is going to be the sodium, the chloride, symporter. Then we move on to the epithelium sodium channel inhibitors. Epithelium sodium channel inhibitors. So under this, the site of action will be the late distal tubule and collecting ducts. The late distal tubules as well as the collecting ducts. So what will be the enzyme of the transporter inhibitor? It is going to be the ENAC. Lastly, we have the aldosterone. There is aldosterone antagonist. So the site of action is late distal tubule and the collecting ducts. So what is inhibited here? Inhibited is the mineralocorticoid receptors. The mineralocorticoid receptors. So this is nothing but indirectly the ENAC. So now let's see a rough pictorial representation of the nephron. So assuming this is the structure, this will be the loop of Henle. Then comes the DCT and the collecting tubule. So this being the PCT, proximal convoluted tubule, and here what is acting is the carbonic anhydrase, the carbonic anhydrase inhibitors. Then we look at the thick ascending loop of Henle. The thick ascending loop of Henle. So in thick ascending loop of Henle, what plays a role is the loop diuretics. Then we look at that this is the DCT. So under the DCT, there is the thiazide diuretics acting. Next, on the other hand, there is the CT, the collecting duct. The collecting duct as well as a distal DCT. So this has the epithelium sodium channel inhibitors. So there is the epithelium sodium channel inhibitors as well as the aldosterone antagonist.